Good evening, everyone. I'm Dr. Vandana Boobna, Senior Consultant based in Delhi. I work in this large corporate hospital, Max Super Speciality, based in Shalimar Bagh. I also run my own clinic in the name of Intermedis. So, this pandemic has been a learning experience for everyone, and the most challenging decision I took was to work as a frontline worker. Though my family was really apprehensive, they have been very supportive. It widened my horizon for work, my thoughts, and my connection to my life and families of my patients. I surely learned lots of new things and tried to implement in my routine life. Teleconsultation came actually as a medical boon to all of us, to my patients also, to me also, because I could connect with them 24 into 7 online. Yes, there was a new practice which came up. I worked more with my senses, my eyes. I listened more, talked more, and examined less, which really helped on for online consultation as well as working in the COVID wards. Has been really challenge to keep pace with the guidelines, which was changing every day. But we always followed the guidelines by Ministry of Health and Family Welfare, and as people were really drowned in the infodemic, we tried to keep updated as much as possible so that we could answer them properly. There has been lots of traumas associated with treating these COVID patients, because I had to admit lots of patients from all over India. They came to Delhi and got admitted under me. I lost two of my relatives. It was really painful to see them dying a slow death despite all efforts. I saw people losing their family members within days and not able to perform even the last rite because of the mandate of the pandemic. There has been trauma of the isolation, both sides, for the patient as well as the attendants, but we were the bridge between them, and we tried to bring smiles on their faces and tried to solve all the fear, anxiety, and uncertainties of this disease they had. My family really worried about my safety. They kept calling me day and night, but yes, I really wanted to do it and I did it. There had been multiple phone calls 24 hours, but I never lost my cool. I answered all the questions, all the phone calls, and I really did everything to help my patients. And the triumphs I had was I never took a single day off till date, and I worked 24 hours despite all the risk. There was every day a new exploration as far as the disease was concerned. Every day I was becoming better by learning about this disease more and more. There's still lots of learn, but now I'm an experienced physician. I have not contacted this disease despite being a frontline worker. Though my family had it, I was caregiver and a doctor both to them, but I just followed the basic rule. My antibody is still negative. I have treated thousands of patients with very few mortalities. Almost 500 patients I have admitted under me, 500 teleconsultations, only 10 mortalities till date. I have seen people having 100% of lung illness and walking back home. The most beautiful moment was when a 38-year-old doctor was admitted under me. She was on ventilator, underwent emergency cesarean, and walked back home with the premature delivered child. So now my family really flaunt my work, and there is no more apprehensive. They are very supportive. And for one admitted patient, I was treating all the family because they were either having symptoms or they were exposed or they were a suspected case. So today I'm a family physician to lots of hundreds of new families I have connected to now. So, as far as the protocol is concerned, we followed the guidelines, but with our experience, we made our own protocols for the home isolation and admitted patients. We used all remdesivir, tosi, plasma, but early intervention, early starting the treatment, steroid, remdesivir, low molecular weight heparin, and oxygenation really brings out a good outcome. Uh, so never shy away from the work what we are meant for. This is my message to the medical fraternity. Personal safety is really, really important. Surely we have guidelines, but we should always follow our gut feeling and trust our experience and work accordingly. For the people, it really required a pandemic for them to be cautious of their health. I hope it continues even then when the pandemic is over. And the COVID diseases, I have experienced that COVID disease is really individualized. If the personal fitness is good, the outcome is really good. If the patient has underlying mortality or their lifestyle has not been healthy, the outcome is poor. So for similar kind of illness, the outcome has been really different. So this is me working as a COVID warrior. The workplace, the hospital, the clinic, everywhere we made changes, whenever it was required. In my clinical staff is trained now, they do not shy away from working on a fever patient. Yes, I'm a proud COVID warrior, and I pledge to work till the end. Thank you so much.